If you're like most of my patients, you're already an accomplished human being. You lead, you administrate, you manage, you perform. But lately, perhaps, maybe your reflection of who you are hasn't been keeping up with the person that you still feel like inside. That quiet doubt, that subtle disconnect, is more common than you think, and I'm here to help you take control of it. My name is Dr. Ken Williams, and I spent over 4 decades helping people regain more than just their hair. As a board-certified hair surgeon, author, educator, and contributor to the medical science and literature, I have dedicated my practice to helping men and women restore their confidence through the science and artistry of hair restoration surgery. And I know how personal this journey is because I've lived it. I've had 5 follicular unit excision procedures myself over the past 15 years with over 10,000 grafts placed. So I know what it feels like to see your hairline change and you lose your density. And I often understand that quiet loss of presence that often comes with it. Hair restoration isn't about vanity, it's about your identity. And for professionals like you, whose image plays a great role in your influence in society, it's about your credibility and self-respect. But here's where many patients and people go wrong. They chase convenience. They respond to advertisement on social media for discounted procedures. They choose clinics where the surgeon might not even meet them before the surgery, let alone perform the procedure itself. These clinics often use templated hairlines, delegated work to technicians and staff, and the results, unfortunately, are hairlines that look fake or, at best, unnatural. A hairline that doesn't suit your face or age can do more the damage what you think it has already done with the hair loss situation in your life. And once the surgery is done, it's hard to reverse. I see patients like this all the time, and they come to me because already after spending thousands of dollars, I have to fix a really bad mistake. That's why I do things differently. I meet with every patient personally, and I design your hairline based upon your facial structure, your career presence, and long-term goals. I perform every procedure myself, all the quality steps from start to finish. There are no shortcuts, no rushed timelines, and no quotas to meet. And if after we've had our consultation you want to move forward, we'll begin to create a treatment plan that's tailored to you and your lifestyle. Whether that includes regenerative therapies, medical care, surgical care, or simply the discretion and comfort of a private surgical setting and office where I can meet your needs and you come first. So if you're serious about restoring not just your hair, but the way you carry yourself and the way the world looks at you, I invite you to take the next step. My team and I will review your assessment responses, and if it's the right fit, we'll invite you to a private consultation with me directly. There's no pressures, no pushy sales tactic, just clarity, care, and the kind of transformation that helps you feel like yourself again. Now, if you're ready, click the button below to take the assessment to determine if the executive hairline procedure is right for you. I look forward to meeting you, and I want you to help rediscover your edge and what you feel like you are within your heart and soul.